this is Dr. Meghan Karol. I am a pelvic health physical therapist. Today we are going to be talking about pain with intercourse. Now, if you're into that, then go for it. But if that's not the intention, really pain has no place in your bedroom experience, sexual experience. So if you're having any pain with it, intercourse, look into that, figure out what's going on, reach out to your primary care provider, your gynecologist, your pelvic health physical therapist to figure out what is that component. It could be a muscle component. So these muscles have to relax and allow penetration to occur if that's part of your sexual experience, or even touch sensation if they're spasming in response to that. So sometimes that can be very painful. Sometimes over time, especially as your hormones are shifting, especially postmenopausal, when estrogen is really, really low, it's called vaginal atrophy. So just like your skin, your skin is going to get a little bit more thin, a little bit more dry over time. So does that vaginal tissue. So sometimes that could be a little bit painful if there's not really a good robustness to that tissue. So again, talking to your gynecologist or your primary care provider, seeing if there is a medication, whether there's a cream or supplements that can kind of help with that tissue plumpness could be very helpful. Really, bleeding has no place with intercourse. So if there's any bleeding, definitely immediately follow up with your medical provider. And lubricant is your friend. So again, over time, our body kind of dries out a little bit, and our natural lubrication isn't as robust as it used to be. So you definitely want to utilize a lubricant for, especially if you're having any penetration. You want good, clean ingredients. There should be nothing scented or fragrance or hot, cold, things like that. You really just want a nice, clean, natural lubricant. And you can look online for some different brands. There are some that are silicone-based or water-based, aloe-based. There's kind of a lot of different ones based on your personal preferences. You want to actually spend the time going through proper arousal. So with our arousal state, our tissue actually does provide more of that natural lubrication. Our muscles should relax a little bit. The vaginal canal actually lengthens a little bit. So the body is a little bit more primed and prepped and ready. Just think about like if you were going to exercise, you would have your warm-up period, your activity, and then your cool-down period. So for your pelvic health, as well as your cardiovascular health, you want to take your body through that same thing for your sexual experiences too. Have that arousal increase warm-up period, have your activity, and then have your cool down. Allow your body to kind of come back down to its resting state. Hope those are helpful for you. There's so much more that we can talk about too. So again, if you're having any pain with intercourse, don't let that become your normal. Reach out to your medical provider or your pelvic physical therapist to get that addressed.